So certain other features that I talked, that the nystagmus that is seen on the eye, the various types of nystagmus that are seen in the case of the alcohol intoxication. Due to the effect of the alcohol on the vestibulocochlear system, the nystagmus is produced in the alcoholics. This nystagmus can be alcohol gaze nystagmus or the positional gaze nystagmus. Alcohol gaze nystagmus, you ask the patient to sit down, and you check the movement on the right and left and the up and down. Then it is indicative of the horizontal and the vertical gaze nystagmus. If it is there, then you check for the positional alcohol nystagmus, that is the pan 1 and pan 2. It is of two types. These types are often indicative of the amount of the alcohol that the patient has ingested. In the pan 1 and pan 2, the patient, to elicit this nystagmus, the patient is asked to lie down and asked to close his eyes. Then you turn the head on the right side and the left side. You see the eye movement. If the eye is turning to the right side only, then this is the pan 1. And if it is turning to opposite side on turning the right, then this is the pan 2. In this way, the pan 1 and in the vice versa on the left side and the right ways it will be done. So this is called the pan 1 and pan 2 nystagmus that is elicited in the case of the eyes examination. Then in the gait, we already talked walk test and the walk and turn test. For the stance, we have to check for the Romberg test after the extending the hands, and the one leg raise test. You ask the person to raise one of his leg and keep standing. He will be not able to balance himself in case of intoxication, and you have to look that there is a grading for this, and you can accordingly you can check that whether the person needs to be considered under the influence or not. One of the very common method is the breath analyzer. The breath analyzer, as you can see in the picture, is often carried by the police personals. They carry at the traffic lights. They will ask you to peep inside this. It will help to record the alcohol concentration in your breath. And as per the Henry's law, the concentration in the breath or and as per the Henry's law, the concentration of the alcohol in the breath is directly proportional to the concentration of the alcohol in the blood. On this principle, this breath analyzer is effective in telling approximately concentration of the blood alcohol concentration. This basically works on the principle of the color change of the potassium dichromate that is further noted by the chromatographs that is adjusted within this breath analyzer. In this way, this breath analyzer works. Then the certain bedside test may be performed, like to perform the bedside test of the alcohol, you take urine in a test tube, you add acetic acid and the sulfuric acid in it, then heat it gently for the 1 minute. A strong fruity odor due to ethyl acetate indicates the positive result for the alcohol. However, in this case, we cannot quantify it, but it is indicative that the person has intake of the alcohol. So this is the bedside test that can be performed at the at the site of the clinical examination itself. Then after that, the samples shall be sent to the laboratories, toxicological laboratories. Definitely, as we collect in the case of poisoning, the samples shall be sent to the forensic science laboratories that are the authentic, and that is actual duty of the doctor to preserve the sample. As if he doesn't preserve the sample for the forensic science laboratories and sends it through the police personnel, then he may be liable for the destruction of the charges of the evidences. So he must collect the sample for the toxicological analysis. That can be the blood. For the blood, sodium fluoride is used as a preservative. Saliva may also be collected. Saliva is easy to collect, and so it is one of the then the urine sample is also very good sample for the detection of the blood alcohol concentration. The blood urine alcohol ratio is 1:1.3. That is, the urine concentration must be multiplied by the 0.5. That is, urine concentration must be multiplied by the 0.75 to get the blood concentration. So that means the blood concentration is lesser while the urine concentration is higher. So by the serial monitoring, at least 2 samples shall be taken, one immediately and another after 2 hours, so that you may able to know that the intoxication is in the absorptive phase or the intake phase or the excretory phase. That will be able to tell with the help of the levels that are appreciated in the 2 different samples of the urine. So 2 samples of urine shall be collected ideally. and they all shall be sent to the laboratory. In the laboratory, the best test for the alcohol estimation is the gas chromatography, is the most reliable method. Other methods, Cavett's method and other sorts of methods are also there, but now it is best performed by the gas chromatography. Then another important concept related to the drunkenness or the blood alcohol estimation is the Widmark's formula. The Widmark's formula is used to calculate the amount of intake of alcohol based on the blood alcohol concentration. So the formula is A is equal to CPR. Here A is the alcohol ingested in the grams and the C is the concentration of the alcohol in the blood in decigrams. So this is blood alcohol concentration in decigrams. P is the weight of the body in kgs and the R is the Widmark's constant, that is for male it is 0.68 and for female it is 0.55. So you might have already known that the different amounts of the intake of alcohol in male and female has different blood alcohol concentration. So based on that, this Widmark constant is different. Based on that, Widmark's constant is different for males and the females. So by this formula has got devised that A is equal to CPR. So you may be asked various numericals based on that, and if you suppose some person has, so you must know that what type of alcohol has what concentration of the ethyl alcohol, and according to that the different blood concentration will be there. So from there blood concentration, what amount, what gram of the alcohol he has been ingested, and that means we may calculate the what number of pegs or the what number of the standard drinks he has consumed before. Then comes the final step, that is the opinion formation. The opinion formation should be phrased in one of the following ways. That could be that is you have to use one of these three wordings, that is the individual examined has not consumed the alcohol, the individual examined has consumed alcohol but is not under its influence, and the individual examined has consumed alcohol and is under its influence. So only these three wordings shall be used when making the report of the drunkenness. So for the person that he has not consumed alcohol, if you are not finding any of the signs and symptoms, you are not getting any of the blood alcohol concentration or any of the lab reports, that all are the suggestive negative. So that in those cases you have to write A. Then opinion B is given if there is a smell of alcohol in the breath and laboratory analysis reveals the presence of alcohol, but the clinical examination reveals the normal finding. That is, clinically he is not having the muscular incoordination, nystagmus and all those the features of the influence of the alcohol. Then in those cases you have to give the opinion B. And if you are finding the clinically that there is a positive signs of the intoxication, and along with that you are having the blood alcohol concentration, in those cases you have to opine as C. In this way you should submit the opinion on the drunkenness. Thereafter, after the completing opinion, definitely you must make the signature. Unless you sign any document, it is of no value, it is useless dust paper, it is useless piece of paper. So you must sign, you must write your name. So you must sign, you must write your full name, your designation, your NMC number, all these things should be written at the end of the opinion. Then various medical legal sections that are relevant with respect to the alcohol intoxication. One of the important section is the Motor Vehicle Amendment Act 2019. One of the important act is the Motor Vehicle Amendment Act 2019. This act is the further amendment of the Motor Vehicle Act 1988. In that, under the section 185, it has been explicitly written that whoever while driving or attempting to drive a motor vehicle has in his blood alcohol exceeding 30 mg%, that is the 30 mg per 100 ml of the blood, detected in a test by the breath analyzer. So even the instrument has been mentioned, that the police that is carrying the breath analyzer, if he finds that your blood is having the more than 30 mg% of alcohol, or he is under the influence of a drug, any other drug other than the alcohol, that include the psychoactive substances or any other things, to such an extent as to be incapable of exercising proper control over the vehicle, shall be punishable for his first offence with an imprisonment for a term which may extend to 6 months. So if someone is found drunk and driving, that is the blood alcohol concentration more than 30 milligram percent, then his punishment includes that the punishment for the first offense includes the imprisonment up to 6 months or with fine which may extend to the 2000 rupees. Earlier it was 2000 rupees, now it has been increased to 10,000 rupees. So if you are found drunk and driving, then the police will charge you 10,000 rupees. And on subsequent offense, he may be imprisoned for the 3 years and the fine of on the subsequent offense, if it has been committed within 3 years of the commission of the previous similar offense, then the imprisonment for a term which may extend to 2 years or with fine of 3000 rupees or both. So this 3000 rupees has been increased now to the 15,000 rupees. So on the first offense you will be charged 10,000, on the subsequent offense you will be charged 15,000. In this way, this Motor Vehicle Act is applicable and to prevent the vehicular accidents. So you must know, so every doctor must know these rules as a citizens as well, and to examine the person who is coming under the influence of alcohol by the police. Then another important section is section 85 of IPC. It says that act of a person incapable of judgment by reason of intoxication caused against his will. I think you must already have read about the section 84 of the IPC, that if a person is of the unsound mind, then if he commits certain offense in that unsound minded state, then he will not be accused of the punishment. That is also called, that developed from the McNaughton's rules. That is an interesting story. You must read that story, the McNaughton's rules, how it got developed and how it got applied in the Indian context in case of the section 84 of the IPC. From that only rule, this 85 of the IPC says that if a person is intoxicated, then he doesn't know the nature of the crime. So he must not be, suppose he is totally under the influence of the alcohol and he has been asked to, suppose he is under the influence of alcohol and he misbehaves with a girl or the sexually assault her, then in those cases it has been said that he doesn't know the nature of the crime that he is committing. So it is similar to a mentally ill person. He is under the influence of alcohol, so he shall not be charged for the punishment, and this is only applicable if the alcohol or any drug administration is not by himself or without, it has been taken without his knowledge or against his will. Suppose some person gives any psychoactive substance or deliriant, or you may say the sexually arousing agents to any person without his knowledge and without his will, in his drink he mixes it and he commits the crime or sexual offences under that influence. So he will not be liable for the punishment of the sections of the sexual offences. So this provision says that if the intoxication has been done without his knowledge or against his will, in those cases he will not be punishable. This has recently you must be knowing that this Indian Penal Code has been changed to the Bharatiya Nyaya Sanhita, that shall be applicable from the 1st of July. So under that, this 85 section has been as it is adopted under the clause 23 of the Bharatiya Nyaya Sanhita. Then the section 86 of the IPC is again 85 and 86 are both related. Here it says that he will be punishable if he knows that he has himself taken the drug or the alcohol and he is not administered against the bill. Then in those cases he will be liable for the punishment. This is now under the clause 24 of the Bharatiya Nyaya Sanhita. Then another important section is section 510 of the IPC, that is about the public misconduct. That says that whoever in a state of intoxication appears in a public place or in any place which it is a trespass in him to enter and there conducts himself in such a manner as to cause annoyance to any person shall be punished with a simple imprisonment for a term which may extend to 24 hours or with a fine which may extend to 10 rupees or with both. So this is basically public nuisance that is being created under the influence of the alcohol. Like you may find is very commonly that some person after the intake of alcohol start abusing someone, he start misbehaving with someone. So all those things, or shouting or creating nuisance in the society, in those cases the police will pick the person for 24 hours, he will put him in the lockup, or he may charge the fine. Earlier it was 10 rupees, now the fine has been increased under the Bharatiya Nyaya Sanhita clause 3 for under Bharatiya Nyaya Sanhita clause 353, the fine has been increased to 1000 rupees. Also there is inclusion of the community service punishment that has been newly incorporated under the section. So now I suppose with increase in fine, this will decrease the tendency of the alcoholics to create the public nuisance, as this will take away a large chunk of the money that they can utilize for the drinking. So definitely this will decrease the tendency of creating public nuisance under the influence of the alcohol. And lastly, the important medical legal aspect with respect to the alcohol is that if a surgeon operates while intoxicated and the patient dies during the surgery, is that of the ethanol exposure and its association with the occupational practices, like suppose in cases of doctors. So if a person is performing his duties, or any other person who is performing his duties under the influence of alcohol, then definitely the work is getting affected. Then the civil services rules are there who punishes him. He may be charge seated, or he may be so-called may be sued against him. All those things are there with respect to the conduct rules. Then the legal aspects with respect to the alcohol intoxication, particularly in respect to the doctors, there could be the three different scenarios. One scenario could be that if a surgeon operates while intoxicated and the patient dies during the surgery, the surgeon can be prosecuted under the section 304 of the IPC that has been adopted as it is under the clause 103 of the Bharatiya Nyaya Sanhita. So being drunk during the operation is a strong evidence of the recklessness. So this 304 of IPC is the rash and negligent act. So if you are performing rash and negligent act, you will be punishable under the 304A of the IPC. Here the punishment is up to 7 years. And then another scenario could be that a doctor can face a lawsuit. That is normal. He faces a lawsuit because of the certain allegation by the patient. If a patient suffers harm or death due to the negligent treatment, if the doctor was intoxicated while administering treatment, it further strengthens the case against him. Although he was not negligent, or he did correctly, and he might have certain normal complications, but it is found that he is intoxicated, then it goes against the doctor. This shall also be kept in mind. Then even if the legal actions are not involved, then in those cases the managing a patient while under the influence of alcohol is considered the professional misconduct. The 6 A's of the professional misconduct you must know. In that the A is the alcohol also. So the doctor may face the disciplinary action from the State Medical Council, including the possibility of being struck off from the medical register. In this way, he may be punished from the National Medical Council as well, and his name may be removed, or the temporary cessation of his name from the register may be done. So this is under the professional misconduct as well. So this is all with respect to the alcohol. Thank you so much for your patient listening. Best wishes for your career. Thank you.